There's been a renewed focus on ways to keep our brain healthy, not only our mental health, but our brain, which governs all our bodily functions. And while older adults face a higher risk of various neurological disorders, it's important for everyone to prioritize brain health starting now and way into our golden years. Hi, everyone. I'm Tamika Bickham, your host for today's discussion, coming to you from the Baptist Health Newsroom. And Alzheimer's affects millions of people worldwide, with more than 6 million Americans living with this, and it's expected to rise. So today we are joined by neuropsychologist at the Marcus Neuroscience Institute, Dr. Raphael Wald. Great to see you, and thanks for joining us for this important discussion.
Hi, Tamika. Thank you. Good to see you.
Now, before we dive into today's subject, I want to remind our viewers to go ahead and send in your questions and your comments in the comment section below throughout this discussion, because of course we are here for you to answer any questions you may have. So let's go ahead and dive in. Now, Dr. Wald, let's start with the basics. Catching Alzheimer's early can be an opportunity for more treatment options and also greater benefits. So can you tell us what the early signs of Alzheimer's are?
Generally speaking, the hallmark of Alzheimer's disease is memory loss. And when I say memory loss, I mean short-term memory loss. So a lot of times people will come in and they'll say, you know what? My father can remember things that happened 30 years ago, but he has a lot of difficulty remembering that someone came to visit him yesterday or a TV show that we recently watched. So really the first sign very often is short-term memory loss. And then another sign that often happens very early is aphasia, problems thinking of words that a person wants to use in conversation.
And so what would be the sign that when people should go and see a specialist when they're noticing those things?
Yeah, great question. Anytime anybody is concerned, that's what I say. I mean, the worst case scenario or best case scenario is that you went and nothing's wrong. Hopefully that's the case, but anytime anybody is concerned, a child, a spouse, a partner, the patient themselves, anytime someone is concerned, that's a good time to go visit a doctor and look into it.
Now, discovering a loved one's Alzheimer's diagnosis can certainly be emotionally overwhelming for families. So from what you have seen, how can Alzheimer's diagnosis impact family members emotionally? And what are some challenges they may face in coping with the diagnosis of their loved one?
Yeah, I think in my experience, the thing that is sort of shocking for people is thinking into the future and looking into the future and sort of the uncertainty that comes along with it, knowing that things are going to continue changing the way that they have noticed them change, knowing that a person is going to need more and more help as the years go by. There's a lot of shock that comes along with that. I think a lot of people do think of it as meaning that a person is going to die very soon. But, thankfully, people with Alzheimer's disease, the average life expectancy for a person from first diagnosis is 8 to 10 years. So it certainly isn't a diagnosis that means that someone is going to die imminently, but it does mean a lot of changes are coming.
Is there a typical age that people tend to see the onset of Alzheimer's?
So I wouldn't say that there's necessarily a typical age, but the way I think people should think about it is that with every decade that we age, our chances of developing Alzheimer's disease increase exponentially. So when we're in our 60s, there's around a 10% chance of developing Alzheimer's disease, and then it just goes up from there significantly to your 70s and 80s and so on.
Now, I want to move to our next question about everyday life. In everyday life, people tend to interchange Alzheimer's and dementia. I know we were talking about this a little bit earlier. And while they share the common characteristics of memory loss, there are distinct differences. So can you explain those differences for us?
Yeah. So dementia is a description of a cognitive impairment. In other words, by definition, dementia means that a person has an impairment in their memory and at least one other thinking skill. So that could mean their ability to see things in space. It could be their ability to focus on something for a brief period of time. It could be their ability to juggle information in their head and then give it back to someone else in a different form. So dementia is a description of an impairment in memory and at least one other thinking skill. And there are many, many, many things that can cause dementia. Alzheimer's disease is one of those things that can cause dementia. It is the most common cause of dementia, which is why you hear it so frequently, because it is the most common cause of dementia.
Ah, okay. So there's many things that can cause dementia, Alzheimer's being one of those.
Correct.
Okay. All right. Thank you for explaining those differences. After receiving an Alzheimer's diagnosis and understanding the potential next stages of care and support for the patient is crucial. So could you provide some insights into the potential next stages of care and support for the patient?
Yeah, I mean, the way that you want to look at it is looking at activities of daily living. That's really an important term to look at. So, activities of daily living are just the things that you and I and everyone else do on a daily basis in order to live our lives. So, that includes getting ourselves dressed, it includes brushing our teeth, it includes cooking for ourselves, cleaning up after ourselves, it includes going to the bathroom on our own, shaving. It includes driving. So, really, the way to look at it is in terms of the activities of daily living. What is the person capable of? What are they starting to have a hard time with? And supporting them as they have more and more problems with different activities of daily living, just to make sure that they're safe.
And but since Alzheimer's can lead to a gradual loss of someone's sense of self, somebody else must be able to prioritize the patient's needs, potentially helping with some of those things that you just mentioned. So could you explain what a caregiver is and exactly the role and responsibilities of a caregiver for a person with Alzheimer's?
Yeah. So, if you look at it as though, a person who does not have dementia can fulfill, let's say, 100% of their activities of daily living, again, shaving, brushing their teeth, driving a car, cooking. So as Alzheimer's progresses, the percent of activities of daily living that a person is capable of fulfilling on their own slowly decreases. So now they're only able to do 85%, and then over time it's 75%. So a caregiver's job is to fill in that gap. So now if the person can only do 75%, the caregiver fills in the other 25%. So now the caregiver is driving for that person because the person can't safely drive anymore. Or now the caregiver is cooking for that person because the person can't really cook for themselves anymore. And being a caregiver is tough work. There's a ton of stress that comes along with it. And caregivers need respite, they need a break. Caregivers themselves are at an increased risk of developing dementia because of all the stress that comes along with being a caregiver.
Oh, wow. And so as I, just heard you say there, those responsibilities and the decreasing amount of the patient and what they would be able to do, the caregiver should go into it knowing that, hey, if I'm doing 15% for long, or at some point, I should expect to increase the support that I'm offering this person.
Exactly right.
So the next question that I have, and is certainly on everyone's mind, I know mine as well. What can we do for ourselves now to keep our brain healthy and reduce our risk of developing Alzheimer's or any other brain disorders?
A really good question. It's a really important question. So, the number one risk factor for developing dementia or Alzheimer's disease for that matter is increasing age. So, the older you get, the more likely you are to have it. And there's nothing you can do about that. You're going to keep getting older. The second biggest risk factor for the two most common causes of dementia. Okay, so the two most common causes of dementia are Alzheimer's disease and vascular dementia. Alzheimer's disease we've discussed, and vascular dementia is when a person has one or more strokes that cause a cognitive impairment. And sometimes the person doesn't even know they're having those strokes when they're having them. But the two biggest risk factors for both Alzheimer's disease and vascular dementia are any vascular risk factor. So that means high blood pressure, high cholesterol, diabetes, obesity, thyroid disease, sleep apnea, atrial fibrillation. All of those are vascular risk factors. So basically, anything that's bad for your heart is going to be bad for your brain as well. So, in order to give yourself the best chance of not developing dementia, if you have any of these conditions or if you are at risk of developing any of these conditions, you want to partner with your doctor in order to make sure that they are very much under control. Exercise and diet are huge. So what I tell people is always do it with someone else, but you want to try. The goal is to, assuming you're healthy enough to do so, you want to try to get 30 minutes. It does not have to be intense aerobic exercise, but go for a 30-minute walk 5 days a week. Not only is it great for preventing the development of Alzheimer's disease or other forms of dementia, it's also incredibly good for your mood. So exercise, diet, and overall vascular health, those are the most important things.
You know, as I'm hearing you talk and also having been a part of other conversations here on this live stream, it all sounds like a chain reaction, right? When we talk about things that can decrease the potential of having a stroke, heart disease, certain cancers, right? The high blood pressure, the high cholesterol, all of those things tend to come up. And it's just hearing you say, hey, those things could lead to the possibility of a stroke, which then could lead to the correct me on the name here, the vascular dementia, which
Right. Yeah.
then could ultimately lead to having dementia. So it sounds like it's really age we can't stop, but healthy lifestyle choices, diet, exercise, and those key numbers and keeping those down sound like key things that we do have control of, which we should be proactive about right now.
Exactly right. Exactly right.
Any other actionable tips that we can do for overall brain health other than food and exercise that we haven't talked about?
Yeah, I do think that keeping your brain active, cognitive stimulation, so doing crossword puzzles, reading, playing brain stimulating games on your phone, that is important. But I do really encourage people to do that. But what I think is even more important is doing your best to stay happy, because what happens a lot of times is when people do suffer from pretty profound depression or anxiety, is that their thinking skills as they age tend to kind of fall off a cliff a little bit. So I think that dealing with depression and anxiety or other psychological problems, getting treatment for them, if your doctor feels it's appropriate, taking antidepressant medication, exercising, which is really, really good for depression and anxiety, surrounding yourself with people that you care about and that care about you. So I would say, in my opinion, again, it's vascular health, and then happiness, and then cognitive stimulation. So engaging in activities that are stimulating for your brain, like Sudoku and crossword puzzles and so on and so forth.
Okay. And it also makes sense too about staying happy, right? And keeping your brain and your emotions feeling good, because as you mentioned earlier, caregivers tend to be at increased risk for developing this as well because of the stress that they're under.
Exactly right.
I want to move on to another question. Most of us have heard about Bruce Willis's devastating dementia diagnosis and how his daughter opened up about supporting someone with the condition. So in your experience treating patients and getting to know their loved ones, what are some ways you would advise people to offer support to the caregivers in their lives?
Yeah, I think that one of the biggest concerns is that people with dementia do sometimes develop agitation. And just to note that not everybody with dementia develops agitation. Some people become more docile, some people stay exactly the same personality wise, but there is a tendency for some people to become very agitated. And I think a key is just doing your best to remember that this is the same person in that body that wants to treat you exactly the same way they always have, but there is a process going on inside their brain that is hijacking their behavior, right? So try to separate the person from the behavior. It's the person that you love that is engaging in a behavior that you don't like. So just try your best to keep that in mind. And when it gets to be too much, give yourself a break. Don't assume that you don't need a break, because you do. So it can be too much for just one person to handle.
That's a great point, and something I was going to ask. What is something that you see caregivers, especially if they're a family member, have the hardest time with throughout this caregiving process?
Yeah, agitation is a big one, just because uh, it can be almost impossible sometimes to keep in mind that the person that's doing this to you is acting agitated towards you or taking out anger on you. They don't want to be doing it. Again, it's like their brain was hijacked by this process that they have no control over, and they don't want to be treating you this way. They just unfortunately are. So I think trying to keep in mind that this is not their choice. They don't want to be doing this. Separate the person from the behavior. Do the best you can. We're all human.
Absolutely. Great tips. And like you said, it's okay to need a break as well. I do want to go ahead and take a question from one of our viewers. And I know you mentioned this earlier about aphasia. So can you explain to us a little bit more what exactly that is and how is it developed?
Yeah, aphasia is a broad term which describes any problems that a person has with their speech. And when we get kind of really nitty gritty, we divide a person's speech capabilities into other categories. So there's a person's ability to speak fluently. So, in other words, they speak without choppiness and without breaks in their speech. A lot of times people do that because they have a hard time thinking of words that they want to use. So their speech will halt multiple times along the way. That's called fluency. There's anomia, which is difficulty with naming things. So in other words, if I were to show a person a picture of a rhinoceros, they would look at it and they'd say, I've seen that thing so many times. What's the name of that thing again? What's it called? That's called anomia. That's another subcategory of aphasia. There's problems with comprehension. So a person might be able to speak, but they have a hard time understanding other people. And then there's repetition is an important one. So being able to hear what a person is saying to you, say a short phrase like no ifs, ands, or buts, being able to hear that and repeat it back to the person exactly the way that it was given to them. So there are a lot of little subcategories underneath it, but generally speaking, aphasia is your overall speech ability and impairment in your overall speech ability.
And lastly, before we go, Dr. Wald, I did want to ask you about any of the latest research or findings on treatment and also what treatment does look like for those with Alzheimer's.
Sure. So there are two classes of medications that have been around for quite a while, the NMDA antagonist and the cholinesterase inhibitor. That will not be on the quiz later, but those are the two classes of medications. They've been around for quite a while. A lot of times you'll hear people say, well, they can give you a boost for 3 to 6 months, and then they don't help quite as much afterwards. And certainly I've seen a lot of people that don't get much of a boost at all. I've seen people that get a pretty significant boost. It really depends from person to person, assuming they can tolerate the medications. The latest changes now, and where the huge thrust of research is on monoclonal antibody therapy. So basically, these are medications that treat the pathology, the abnormal bodies that start to show up on the brain with Alzheimer's disease, these plaques and tangles, right? So they treat these abnormal bodies as though they are invaders, like a virus, and they attack them as though they are viruses, and they try to get rid of them as though they are viruses. So they kind of try to expel those from your brain, essentially. It's complicated because there are a lot of things that can go wrong when that happens. It can cause a little bit of bleeding in the brain. It can cause a little bit of swelling in the brain, which is why it's not quite as simple as it sounds. There has been a medication that was FDA approved that had a lot of problematic side effects that isn't prescribed very often. There's another one that was FDA approved more recently, which is a little bit better, but it's only available by infusion. It's very expensive. We're waiting to hear if Medicare is going to cover this medication or not. So that's kind of the wave of the future where a lot of the research is right now is on this monoclonal antibody therapy. So that's kind of where we're at. There has been some promising data, but we have to make sure that everything continues to be safe.
Certainly. And Dr. Wald, thank you for that. I'm sure you'll keep us posted on those latest developments. And thank you overall for such an informational and important conversation and for sharing that insight as well with our audience. And to our viewers, remember, be sure to go ahead and hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. You can also connect with us. We are everywhere on social media, Facebook, Instagram, Twitter, TikTok, and of course on LinkedIn. And check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all episodes of the Baptist Health Talk podcast as well. And on behalf of everyone at Baptist Health, stay safe, stay healthy, and thank you for watching.